Hospital at home is exactly what it says on the tin. It's care delivered of hospital standard by hospital specialists in the patient's own home. And we do that because for all the patients with frailty, being in an institution can have a downside. So delivering the care that a patient requires when they're sick enough to need a hospital in their own home avoids breaking up the bond with the family, and it avoids several elements of an institution, such as delays, risk of infection, confusion, that can have a significant impact on a frailer patient. When a GP requires admission for an older adult with frailty, the call is diverted to our team and we will go out to the patient's house and be there within an hour. And the team will do an assessment of the patient that takes in everything from their experiences, their health, their medication, family, the setup, the home situation, and establish what we would call a hospital Clarken. They would then be joined by the hospital consultant who would do a plan of care for that crisis, for that illness, just as they would do in hospital, but with the added benefit of being able to discuss it with the family and the patient in their own setting. And we would now normally round that all off within an hour and a half to 2 hours maximum. We do choose to admit some patients who we have concerns about, but they would be admitted with a plan of care with a review by a senior medic. So in a sense, they're not so much jumping the queue, but they're arriving at the point of care in hospital with a plan in place. But the vast majority of people were able to manage in their own home setting. South Lanarkshire's partnership with the Hospital at Home project in East Kilbride area has been absolutely crucial for us. And it brings together a whole range of teams that are already active in the community supporting patients, but brings them into the whole equation of supporting them in an acute medical crisis. So for instance, access to immediate home care, access to equipment, access to social work expertise and knowledge, and for the carers, crucially, access to support for them, being able to assess their needs, are crucial to assessing someone in a crisis and supporting them at home. But longer term as well, we're looking at rehabilitation needs for patients remaining in their own home. And so partnership with the integrated community support teams is crucial to getting ongoing independence for patients. One of the key benefits for Hospital at Home is that it's very much person-centred. We try and bring the care to the person and wrap it around them. And as a wider team, including our kind of partner agencies, we're able to deliver that in their own home on their own doorstep. And in some degree, it gives the power back to the patient. The key thing we want to achieve overall is to have more older people who are healthy, happy, and in their own homes for longer. And that's the goal of Hospital at Home.